Today in video, we will discuss about types of abortion. Type 1, missed abortion. A missed abortion occurs when the fetus has died but remains retained in the uterus without being expelled. It is often discovered incidentally on ultrasound when no cardiac activity is seen, despite a gestational sac and fetal pole being present. The patient may not report bleeding or pain, but sometimes there is brownish discharge or a cessation of pregnancy. Symptoms like nausea and breast tenderness. Complications include infection, coagulopathy, and emotional distress. Management includes expectant, medical, or surgical evacuation depending on clinical status and patient preference. Type 2, threatened abortion. A threatened abortion is diagnosed when vaginal bleeding occurs in the first 20 weeks of pregnancy, but the cervix remains closed, and the fetus is still viable with cardiac activity. Symptoms typically include mild vaginal bleeding or spotting, sometimes accompanied by cramping. Ultrasound is essential to confirm fetal viability and rule out other causes such as ectopic pregnancy. About half of cases resolve, leading to a normal pregnancy outcome, while others may progress to inevitable or complete abortion. Management is usually conservative: bed rest, reassurance, and avoidance of strenuous activity. Progesterone supplementation may be considered in selected cases. Type 3, inevitable abortion. An inevitable abortion occurs when vaginal bleeding is accompanied by dilatation of the cervix, making pregnancy loss unavoidable. The patient often presents with heavier bleeding, abdominal or back pain, and passage of clots. On examination, the cervix is dilated and products of conception may be visible. Ultrasound may show retained gestational tissue, but often without fetal viability, since the pregnancy cannot continue. Management involves evacuation of the uterus by medical or surgical methods to prevent complications such as hemorrhage or infection. Type 4, complete abortion. A complete abortion refers to the total expulsion of the products of conception from the uterus. It typically follows heavy bleeding and passage of tissue, after which the patient often experiences relief of pain and decreased bleeding. On examination, the cervix is closed, and ultrasound confirms an empty uterine cavity. No further treatment is needed if the patient is stable and there are no signs of infection or retained tissue. Supportive care and counseling are important for recovery. Type 5, incomplete abortion. An incomplete abortion occurs when some, but not all, products of conception are expelled from the uterus. Patients usually present with vaginal bleeding, abdominal pain, and an open cervical os. Ultrasound typically shows retained tissue within the uterine cavity. Complications include heavy bleeding and infection. Management involves removal of retained products, either surgically dilation and curettage, manual vacuum aspiration, or medically with misoprostol.